This conference exists for one reason: to stop the deaths. Today we gather with heavy hearts but with fierce determination. Scotland continues to face a public health emergency. Last year alone, 1,065 people are suspected to have lost their lives to preventable drug-related deaths. That's 3 people every single day, and over 18,000 people since recording of these tragedies started in 1996. Every person mattered.
We're all working towards the same thing: to reduce harm, to save people's lives, and to make the country better.
I lost my son in February of this year, and I honestly think what has got me through that has been the support and the energy that we get from being together.
And the people of Glasgow are really supportive of making sure that we are helping people who are caught up in addiction. One example of that is obviously our journey to opening a safe drug consumption facility in the Thistle in the city, which we have done in the last 7 months. And that is starting to really make a difference in that population who are most at risk in our city.
In March, there was a batch of heroin that was extremely problematic. People were injecting and overdosing before they'd even finished the injection. So we were able to respond very quickly, and those people almost certainly wouldn't have survived had they been somewhere isolated on their own.
COVID was a public health emergency. Literally laws were changed overnight. Billions of pounds of funding were allocated overnight. That, in my mind, is an emergency response. We're treating this slightly differently, in my humble opinion, and we need bolder, swifter, stronger action from leaders to implement the stuff we know internationally works.
I would like to see drug checking facilities so that people understand what they're using and then they can take an informed choice. I would like to see safer consumption facilities across the country in communities. I would like to see them mobile in vans. I would like to see them not just medicalised but actually driven by grassroots communities. So there's a lot that we could do. Let's just be brave enough to try it.
What we need is services based on people's human rights. It shouldn't matter if you show up at a service and your problem substance is alcohol or heroin or cocaine or benzodiazepine or ketamine or whatever it is. That service should be able to support you.
We should be on a journey of wellness in Scotland. For too long we've been on the punitive journey, and I think, again, government is trying to change that. But we should be doing more to help people to be well, and we can see things emerging that are helping that.
The Misuse of Drugs Act is completely out of date, and I'm saying that as a former police officer and now as an elected member. It doesn't support our work in Scotland to tackle drug harm. If anything, it undermines it.
This fight is not just about the fight for drug law reform. This fight is a fight about economic justice, housing justice, social justice, racial justice.
I'm confident that the work that we are doing is having an impact. One day soon, I'm going to sit here and tell you we've turned the corner and invite the world to learn from us.
Why is it important to organize these kind of conferences where people come together from different fields, disciplines, communities?
Every year we host this conference to mark International Overdose Awareness Day. Just having that solidarity from people who all want to make change is so powerful, and particularly there's a lot of family members here and people who have lost people to overdose. But saying that just from being here, hearing some hope and optimism and talking with people in the similar circumstances has really given them that strength to go back and fight the fight and to use that anger, the frustration, the tragedy to make sure that they are determined to make change.
So Scotland has the highest rates of drug overdoses in Western Europe, and how would you explain that? Why Scotland is different from other countries?
I think we've actually got a lot of drivers behind why we have such significant harm coming from substance use, and I think some of that really is to do with poverty. I think that's to do with poverty that's been entrenched over several decades. So it's not just one generation of a family, sometimes it's multi-generational. And I think once you remove opportunity from people, you can actually see that communities themselves descend into a place where people are using any substance to make them feel better. I think some of the other issues that we have at play in Scotland is polydrug use. And a lot of that is worse than some of the other countries around the world. And we have specific issues here with benzodiazepines that are fake benzodiazepines, and that has been ongoing for many years. Now we have people that are using many substances. And in amongst that substance just now, we have the rise of nitazines. So those opiates that are coming across that are manufactured, and they're really strong. And I think people just don't know what they're consuming. So the lack of drug checking for me is a big issue. So safer consumption is one thing that we can do to help people stay alive, giving naloxone out as much as we can. But the spread of these really strong synthetic opioids, the polydrug use that people have, and entrenched poverty, I think, are some of the reasons why we see significant harm here.
We are at the Thistle, which is the first supervised injection site in the whole UK. Can you talk about the place we are in?
People can come here 7 days a week, 9 o'clock in the morning to 9 o'clock in the evening, and use drugs that they've bought off-site under the supervision of nursing and social care staff, with a number of supports available to them while they're on site. We support people with not just their injections, but their wounds, their social needs, their housing, trying to link in and establish positive relationships with families. So we're trying to provide an absolute holistic picture for people. We're trying to create an atmosphere where people feel welcome, they feel valued, they're treated with dignity and respect when they come here. What we can do is we can advise and we can supervise the injections. We'll get them to change the needles so they've got a clean needle. And again, it's about reducing the harm in those injection sites, reducing the wound damage. For example, there's an overdose situation. We can respond very quickly. We've had 51 overdoses since the service opened in January. All of those have been resolved. There's been no fatalities. What we've tried to do is give people an environment that looks good, that's welcoming, that's comfortable. So if they want to lie on those couches and go for a sleep, by all means they can do that. You know, often what we've heard from the family reference group, and mothers in particular, is the wait and that chap at the door from the police. They don't know if their son or daughter's alive or dead. So we can say to them, do you want to phone your mum and let her know you're here and you're okay? But it's no pressure, you know, if they don't want to do that, that's fine. But if that's something they want to re-engage with a family member, we'll support them to do that. You can go next door to heroin-assisted treatment. You've got access to same-day opiate replacement therapy in Glasgow. So if people come in and tell us they want to go on a prescription, we can access that the same day for them. That's easy for us to do. There's a housing first team in this building. If it's 9 o'clock at night, we need to get somebody accommodation. We've got somebody we can link them in with. We have abstinence-based residential services, so people can get rehab from a varied number of resources. So if they want a 12-step model or a different model, we can access that for people.
We've had decades-long issues with discarded needles in play parks and people's gardens, things like that. We want to reduce that as much as possible, and we think that we are going to be able to do that with the people who are using the service. We've had nearly 5,000 injections taking place in the facility. That's 5,000 injections that would have been taking place in the streets and the gardens and the parks. Our council's technical design teams came up with plans and proposals, but we presented them to people who lived and lived the experience, and they've shaped the design of it. But what they have most crucially done as well is those panels were part of the interview panels for the staff.
As the head of the leading drug policy organisation in Scotland, how do you see the progress that has been made in Scotland as a response to the overdose epidemic?
So we've been advocating for years for there to be more attention on this issue. And several years ago, there was an acknowledgement from government that they had not done enough in terms of support and protection for people who use drugs, and really trying to challenge this issue and tackle this issue of drug-related deaths. And at the time, a new minister was introduced, a ministerial position to focus specifically on drugs policy, and that was really positive. The drugs policy position at the moment is evidence-based, it's got a harm reduction focus, and all of the things that are being promoted through the policy at the moment are things that we would support as an organisation. The issue is the implementation, and the implementation gap is measured in deaths.
We have made a lot of progress So we've implemented medication-assisted treatment standards right throughout the country. We've expanded the capacity of residential rehab. We've developed the Thistle, a safer drug consumption facility. We have a global, world-leading programme of naloxone provision. So we've worked really hard to make sure that naloxone is available everywhere. So the police carry it, ambulance carry it. Ambulance actually hand out home naloxone kits to people that they attend who've had a near-fatal overdose. It's available in pharmacies. We're working in prisons and fire service, so we're doing a lot of work on the naloxone programme. We are working reasonably effectively with the new Westminster government on a number of issues like drug checking and drug testing facilities, which will be really important.
We have had a lot of improvements to our medication-assisted treatment system, but not enough. We have talked about drug checking services, but that's not being fast-tracked. We're very delighted to have one safer drug consumption facility, but we need a rollout of them in every area across Scotland that needs them. We need to make sure we don't take our eye off the ball with naloxone. There are so many things that we need to be doing faster and at scale to truly address this as the public health emergency that it has been described as.
We like to deliver pilots, say, every programme. Even if it's a programme that's been getting delivered somewhere for 50 years, Scotland still wants to deliver a pilot for 2 or 3 years, then evaluate it, then decide if we're rolling it out. It's like, there's 50 years of evidence there, just roll it out. Forget the pilot, roll it out.
What we're seeing in Scotland is emerging trends in a contaminated drug supply that can, have very kind of specific local focal points and then be come and gone. And I think that's a real reason why we need on-site drug testing now. We need to not be waiting months and years for the Home Office licences and all that kind of approval process to take place.
We also need to have services that meet the needs of people that are maybe in full-time employment but like to binge on cocaine Friday, Saturday, Sunday, go back to work Monday to Friday. We don't have services for the individuals.
The Thistle's open, it's running, people are using it, lives are being saved. Let's look at expanding that model. Mobile, safer drug consumption facilities. So we need to look at different models that suit the locality. I've got a background in my personal life in homelessness and also working in homelessness. I would want to see services like that co-located in temporary accommodation. If it was for residents, they're already living in the service. We know often people are using in these temporary accommodation services. We could have a room dedicated and staff dedicated to observing.
We need to push those Home Office licences that we've put in for drug checking facilities. We need to push local areas so that they are delivering the medication-assisted treatment standards so that people can get access to same-day treatment. And we need to make sure that there's pathways into residential rehabilitation if that's what somebody wants. And we need to make sure that we support all of those community-led organisations out there that are giving people a place of connection, a place of community, right at the heart of their own town, because then that starts to reduce stigma. If people in a community can see people who are using drugs as being just like them, then you stop the othering. And I think that's somewhere that we need to make sure we're still pushing for.
I used drugs when I was very, very young, maybe 7, 8 years old, sniffing solvents, gas and glue, but very quickly started using benzodiazepines for about 12 years old and used that for almost all my adult life until I came into abstinence-based recovery. But sadly, as a result of living that sort of life, I spent maybe 18, 19 years in prisons and other institutions. So for me, my own personal choice of recovery is abstinence-based. But my understanding of recovery doesn't need to be anybody else's.
What does harm reduction mean to you? How does it relate to recovery?
We like to create these opposites of harm reduction versus recovery. Actually, recovery isn't possible without harm reduction. Almost everybody that I know have engaged in some form of harm reduction before they've got to a place of abstinence-based recovery. If you're using heroin and you make a decision to stop injecting it and start smoking it. That's harm reduction. But to you, that might also mean recovery, because you're no longer injecting.
Do you think there is a political consensus in Scotland about how to respond to this epidemic?
I think there are different opinions from politicians about how this issue should be addressed. I think there's a general consensus from most parties that a harm reduction, a public health approach is definitely the approach that is required. Sometimes we get into moralising about drug use and, you know, whether we should be promoting an abstinence-based or a harm reduction approach, and that's just so unhelpful and detracts from the real issue, because actually people need both at different times in their lives.
For me, it's been really frustrating that harm reduction and rehabilitation have been pitted against each other in some way, because for me, the whole system has to be working in conjunction with each other. So we need to be investing, absolutely we need to be investing more in rehabilitation, but it's really vital that we're investing in harm reduction as well at the same time, and balancing that spend between both of those things are really, really important.
As an organisation, how do you make sure that the most affected communities and people who use drugs are meaningfully involved?
One of our key values at Scottish Drugs Forum is the meaningful involvement of people who use drugs or people who have lived or live in experience. And we demonstrate that through the work that we do by making sure that we are actively including those voices through our peer research programme that we do. We have a supported employment programme to get people with history of substance use into employment in the sector. And we also gather together people with living experience across the country to make sure that the issues that are important for them locally are raised at a local level to be actioned.
Right now, your kind of mission is prevent overdoses. Can you talk about your work?
I call myself a peer naloxone pusher. I'm about all things that are reducing trying to reduce drug deaths. So we're set up in a lot of different areas, a lot of prisons, high risk time for people being liberated from prison. So we train up residents to train other residents that are due to be released into the community. But to the best of my knowledge, nowhere else really in the world has actually got residents in prison supplying prescription-only medicines to other residents to help reduce harm.
How can you make sure that you incorporate human rights into drug policy work?
I've been part of the change team, which is the national collaborative in Scotland. And the change team was brought together people with living experience and family members to develop a charter based on human rights. There's no point in writing a charter and developing a charter for people who are affected by substance use in terms of their human rights if they don't know what their human rights are. So we've got a big piece of work and a big bit of the journey still to go to upskill and educate people on what their rights are. We're dealing with something with a legal framework here that if you don't deliver it, there's opportunities for living experience, family members, services to then bring about a legal challenge to the Health Board, to the Prison Service, to Police Scotland, to alcohol drug partnerships. Hopefully we start to see a funding model that's based on human rights. And if you can't demonstrate how you're delivering people's human rights, then maybe you shouldn't be open to receiving any of that funding.
We also acknowledge the loss of Peter Cricant, whose tireless activism helped raise the profile of the need for safer consumption facilities. With many fellow activists in the room today, we recognise that his passing is not only a personal loss, but a moment of significance for the wider movement. His efforts are remembered with respect.
How do you see Peter Cricant's legacy today?
So I first met Peter in 2020 online, because we were in the middle of COVID. And Peter was setting up the van in Glasgow, so the first unsanctioned drug consumption space in Scotland. Peter showed real bravery and showed what one person can do with support of people in the community to challenge the system. Like, he took extraordinary steps and extraordinary risk to himself and to those who volunteered in the van and to those who accessed the van, to, you know, the legal risks. He took a lot of that on. So I think he shows us what you can achieve when you challenge the system. For everyone who came into the van, he showed them so much care and so much respect and so much dignity. And for many of them, they hadn't experienced that in a long time or even ever. To the fact that there is a drug consumption room in Glasgow today is definitely part of his legacy.
What do you ask policymakers in Scotland? What should be the next steps now here?
Decriminalisation,
yeah.
Definitely.
To take that health approach, we need to decriminalise.
You can't do the health approach if you don't decriminalise. It goes hand in hand. You have to decriminalise to make it a health issue. And that's where the changes will come.
Criminalisation is a source of stigma for people who use drugs. Can you do anything as a city to work with the police to reduce that stigma?
Yeah, so we work really closely with the police, and I think it's good in Scotland and indeed Glasgow that we've been pioneering a kind of public health approach, and the police have taken a public health approach to policing as well, which has really been pragmatic. Our police force are one of the first, I think, anywhere to fully carry naloxone, for instance, to help people who have had an overdose. The policy of the city, effectively, is to pursue decriminalisation for all possession of drug use in the city. We unfortunately don't have the powers to enact that, and in fact the Scottish Parliament don't have the powers to enact that. That really needs to be done at a UK level, because the laws around the Misuse of Drugs Act are obviously reserved to the UK Parliament. But as a city, we have taken a democratic vote that we believe that decriminalisation is in the best interest of people who are using drugs, and indeed the law enforcement agencies as well.
Audrey, the number one thing you do to reduce drug deaths?
For me, one thing I do want to see is a transition into the next session, the next parliamentary session, that makes sure that none of the work that has been done and some of the really positive work that has been done doesn't slip.
I think the first thing is to meet people where they're at without judgment, and I think that's something that the system, despite a lot of warm words, often fails to achieve.
What I would suggest, and the Scottish Conservatives suggest, to enshrine in law a legal right to rehabilitation, because there are too many people at the moment, and I've seen this in the analysis we've done to the Right to Recovery Bill, who are seeking help and support and who can't get it.
We need to recognise this is a particularly Scottish problem, so that's why Scottish Liberal Democrats support the further devolution of the Misuse of Drugs Act in Scotland. That way we can tailor a Scottish solution to this particularly Scottish problem. We shouldn't have a situation where it takes the Lord Advocate saying she won't prosecute the operators of Scotland's Safe Consumption Room in the Thistle Centre in order for it to fly. We want to see safe consumption as a norm right across this country.
The Greens have always believed in a public health approach. We've always believed that the use of the criminal justice system in the way that we criminalise not only drug use but drug users it does more harm than good. If there's one thing that you can do that will make somebody more likely to stay addicted or become addicted, more likely to become HIV positive or Hep C positive, more likely to commit future criminal offences, less likely to ever feel that they've got their life under their own control, it's send them to prison. And we're still doing that. We're still making things worse rather than better for far too many people.
One key barrier here in Scotland is the power of Westminster. How do you see the possibilities for you to change UK drug policies? Like Scotland is often seen as a laboratory for progressive policies. Do you think you can have an influence on the overall UK drug policies?
I would really like to think that we could have an influence on the wider UK policy by demonstrating through a Scottish context that change is possible when you actually lead with a public health response. I think there's a very different approach from Scottish Government and the UK Government in terms of drug policy, which in the UK seems to be very enforcement focused and not acknowledging that a lot of these harm reduction interventions that we're trying to push through in Scotland can really make a difference to people's lives. The unfortunate thing is about the Misuse of Drugs Act is that it's so draconian, it's so out of date, it's so much in need of dismantling that it really prevents us from being able to easily introduce the things that we want to do. So even like really minor things like being able to provide people with inhalation devices when people are smoking crack, and that's on the increase, is blocked because of some terminology in the Misuse of Drugs Act. It's just utterly unbelievable. But also I think sometimes it's used as an excuse to delay things. So I think there are things that we can do in Scotland through our specific legal system and with our independent legal authority, which is the Lord Advocate, to be able to make things happen. So I think we need to make sure that we don't use the Misuse of Drugs Act as an excuse not to push forward things in Scotland.
I'm comfortable with Scotland being the disruptors. I think being a disruptor is a good thing because I think that's where change happens. We just have to make sure that we take our communities with us. I think the politicians have to put the politics aside and actually all get around the table, because what we all want to do is save people's lives.